Here is my audience, 5 of them. Kelly, would you please hold the phone for me?
I don't know what's happening.
How many of you are parents of young children? How many of you were fearful or are fearful of vaccinating? I'm a current licensed practical nurse working in pediatrics. There is not a day that goes by that parents do not refuse or question vaccines. Part of my job is to try to make them see the benefit of vaccinating. One vaccine that parents are typically afraid of is the MMR. Today, I'm going to talk to you about what MMR stands for, reasons parents do not want to give the MMR vaccine, studies that disprove these reasons, and the negative effect not vaccinating has on society. All of my research was found through either the CDC or the WHO unless stated otherwise. Measles is a contagious virus spread through the air when an infected person breathes, coughs, or sneezes. It can stay infectious in the air for 2 hours after the infected person leaves the area. The patient begins by developing flu-like symptoms such as a fever, tiredness, cough, or loss of appetite, and a rash can appear up to 14 days after exposure. It can result in acute encephalitis, which causes brain swelling and permanent brain damage. 2 out of every 2,000 infected die from respiratory or neurological symptoms. There is no known treatment. Mumps is spread the same way as measles through droplets when a person talks, sneezes, or coughs. The person develops flu-like symptoms along with swollen and tender salivary glands, typically noticeably swollen in the neck. Complications include swelling of the brain, temporary or permanent deafness, and swelling of both male and female reproductive organs. Again, there is no treatment available. Rubella, also known as 3-day measles or German measles, is also spread through droplets when a person coughs or sneezes. You can develop a rash on the face that spreads through the rest of the body. Typically, people never have any symptoms at all, and this can complicate things by having swelling of the brain and not knowing why. Up to 90% of birth defects can occur to infants born to mothers who contracted rubella in the first 12 weeks of pregnancy. These include deafness, heart defects, mental retardation, and liver and spleen damage. Again, there is no treatment. Now that I have described the actual diseases, I will talk about the reason parents are refusing the vaccines. Most parents who refuse the MMR are doing so out of fear that their child may develop autism. The MMR vaccine is given to the child around the time that autism begins to show symptoms. Another worry parents express is the mercury content that is present in vaccines. There are also many anti-vaccine parents that we see in the media. Celebrities that preach anti-vaccine reach a lot more people than one can imagine. I have heard parents say that they do not want to vaccinate because we just heard they were bad on TV. Media is very influential. Parents who are refusing vaccines need to be aware of research and scientific facts. I will now discuss studies and events that have occurred to be sure vaccines are safe. To date, there is not one scientific study that has found a connection between autism and the MMR vaccine. The one attempt at saying a correlation between the two existed was conducted by Dr. Andrew Wakefield in 1998. This study has been completely disproven and retracted from publishing. To further prove the safety of MMR vaccine, the CDC conducted a study in 2013 that showed vaccines do not cause any type of autism. The study was published in the Journal of Pediatrics. As far as mercury content in vaccine goes, thimerosal, a mercury-containing component, was removed from all vaccines in 1999. This was with the exception of the multi-dose influenza vaccine. The decision to remove that component was precautionary and aimed at reducing the amount of mercury that infants were being exposed to. There are a multitude of negative effects that stem from not vaccinating your children. Currently, we are experiencing a large multi-state outbreak of measles. In 2013, there were more than 145,000 measles deaths globally, which is about 400 deaths daily. Measles was considered eliminated from the United States in 2000, but has since resurfaced due to not vaccinating. According to USA Today, a mumps outbreak that began in September 2014 in Idaho is continuing to spread. Aside from outbreaks, another negative effect of not vaccinating is decreases in herd immunity. Herd immunity is very important in keeping preventable diseases at bay. When a large amount of the population is vaccinated, the spread of that disease is limited. This, in turn, will protect those individuals who cannot be immunized due to health concerns. Without herd immunity, which we see in non-vaccinating states, those individuals who are not able to be vaccinated are at extreme risk for contracting the disease. According to the historyofvaccines.org, vaccine rates need to be as high as 95% for herd immunity to be effective. According to Trust for America's Hope, less than 90% of children aged 19 to 35 months have received the recommended MMR vaccination. These numbers are regardless of the fact that one dose of MMR is approximately 93% effective at preventing measles, and 2 doses are approximately 97% effective. Today, I have talked to you about the MMR vaccine and what it stands for, why parents are afraid to vaccinate against it, studies that prove its safety, and the dangers of not vaccinating. So when you as a parent are faced with the choice to vaccinate or not vaccinate, be sure to do your research before you just say no.